Good afternoon, sir. I'm candidate M027. And for the purpose of this exam, I've been told to talk to you about a particular topic. So may I confirm what's your name and how old are you? Sir, are you comfortable in this environment, or would you like me to move you to somewhere else? So would you like somewhere else to be to make you feel more comfortable? So I'd like to assure you that anything that we've discussed is under doctor-patient confidentiality and will be shared with your permission. So I'd also like to ask you, sir, what do you know about bone marrow transplants? So I'd like to tell you something, sir. Do you have your permission? Okay, thank you very much, sir. So, sir, what is bone marrow transplant? You put it in simple terms, sir. Bone marrow transplant is a procedure in which stem cells are transferred from healthy stem cells are transferred to replace damaged stem cells. And what are stem cells? Stem cells are cells, are primitive cells that produce our blood cells, that produce blood cells in our body. So the red blood cells, the white blood cells, these stem cells are what produce them. And most times they're usually located in the bone marrow. So, sir, this is what a bone marrow transplant is all about, sir. There are various reasons why we carry out these bone marrow transplants, and some of these reasons include in patients that have cancer of the bone, such as leukemia. You carry out this bone marrow transplant to replace their damaged bone marrow. Also, in patients with diseases such as sickle cell anemia, we carry out these procedures. In patients with lymphomas, so Hodgkin or non-Hodgkin lymphoma, you carry out this procedure. So, in your case, sir, we are carrying out because you have cancer of the bone, you have leukemia. That's why we are carrying out this procedure. So, the benefit of this procedure is that once you carry it out, sir, the symptoms you are currently feeling right now is going to address those symptoms, sir, and it will help the cancer go into remission, sir. Like all procedures, there are risks that could be associated with carrying out this bone marrow transplant. So some of these risks includes there could be infection. There could be after the bone marrow transplant, your immune system is compromised, so you are very susceptible to infection. But don't worry, sir. After the bone marrow transplant, you're going to be placed in a very sterile environment, and you're also going to be placed on antibiotics so that you don't get infections. And also, you could have fever that could last for days, or you'll be given antipyretic drugs to help to reduce the intensity of this fever or prevent the fever in the first place. Also, the possibility that your body could reject this bone marrow transplant, these new stem cells are going to be given to you, sir. But we're going to be placing you on immunosuppressant. These are drugs that will suppress your immune system to reduce the likelihood of your body rejecting these new stem cells, sir. This bone marrow transplant, there are two ways we could do it, sir. There are two ways it is done, sir. The first way is we take healthy stem cells from your own body and then infuse it back into you, sir. Or we could take stem cells from somebody that is genetically close to you, maybe your sister or your brother or your parents. We take their stem cell, take their stem cell and then infuse it into you, sir. But in this case, sir, since you already have a bone cancer, sir, we're going to be taking these stem cells from someone that is genetically close to you, sir. So I know you like to know what does this procedure involves, sir. So this procedure, first of all, sir, about 7 to 10 days before this procedure, we are going to be stimulating the stem cell of your donor, sir, and taking their stem cell. And then after that, sir, we are going to be infusing you with these new stem cells, sir. I don't want you to be scared or anything, sir. I know it sounds like a very scary procedure, but I don't want you to be scared, sir. This is going to be done by medical experts who have performed this procedure countless number of times, so, sir. Don't be worried and don't be scared, sir. So, sir, I would like you to do you understand everything I've already told you, sir? Okay, sir. Do you have any questions for me, sir? Would you like to, in a few words, repeat what I've been saying since morning, sir? Well, thank you very much, sir. So, sir, here is a consent form. Can you please sign it, sir, so that we can start this procedure as soon as possible? Thank you.